Hi there, good morning everybody. I tried to record this video on my computer, but it is not working for me this morning. So I just said, you know what, let's try it on the phone and see how it goes. So my name is Dr. Lindsay Wilkinson. I'm a naturopathic physician and an acupuncturist out of Portland, Oregon. And I really focus my practice on integrative mental health and especially work with psychedelics. Doing harm reduction work as well as ketamine assisted therapy in office and all of the wonderful naturopathic and acupuncture tools that I bring into my practice as well. I have a really strong focus on body work. I do mind abdominal therapy and holistic pelvic care. So really trying to deeply incorporate being embodied as we work in the psychedelic realm. One of the things that I wanted to really talk about that I feel like is missed often with psychedelic journeying is the preparation. So in some traditions, there is this triangle of preparation, journey, integration. Preparation, journey, integration. And it makes a lot of sense because it really facilitates and augments the experience if you can feel prepared as opposed to just going into it all of a sudden without really a lot of thought and intention and grounding as to what it is that you're trying to do. So today I have 5 quick tips, just sort of generally, and please feel free to email me, reach out with questions or more clarification. But let's get started. So the first one that I have to really prepare for any psychedelic journey is to get yourself checked out by a doctor or a medical provider. So this can happen a month before, it can happen several months before. If you're contemplating a psychedelic journey or doing microdosing or ketamine or any of those things, you really want to make sure that your body is safe and healthy for those kinds of journeys. You don't want to create more problems before you're able to have a big experience and integrate it. And so for me, what that looks like with my patients is a 60-minute medical evaluation where you come in, we talk about your whole health history. What are you taking? What supplements? What medications? What's your tendency? Like, what supports do you generally need? Do you tend to have high blood pressure or anxiety or more depression? A combination of all of those things. We do a physical exam that's just whatever is necessary, what needs to be done. And then I sometimes will order labs for patients. Often people will come to me and they haven't had screening laboratory work for a year or even longer, especially with COVID. So if you have insurance, I can order all of those labs for patients, which is really nice and helpful. And I'll be looking at markers like what's going on with your kidneys, your liver function, looking at inflammation, looking at blood sugar. We'll do some basic vitamin screening like vitamin D and different B vitamins that we can look for in the serum lab testing. And then as a naturopath, I do a lot of specialty testing, but usually that's like a little further down the rabbit hole based on what patients' individual needs are. But that laboratory work will really give you as a patient a sense of safety and understanding of where your body is at before deciding to do something like a big journey or a series of journeys or even microdosing, which can change your body's physiology and will be upregulating and downregulating liver enzymes and all of that good stuff. So that can happen months before. It's really nice to prepare yourself by seeing your trusted provider, trying to get some of those labs and foundations done before you journey. The next tip is to really optimize in the week or two before your session. And for me, that really means going back to the basics, the foundations of health. So really focusing in the few weeks before a journey on hydrating, getting your body clear and clean and having enough of the essential vitamins and nutrients and water that it needs to really process a big emotional or psychic experience. So yeah, I talk a lot about hydration and just basic nutrition, like trying to keep your body really full of nutrients that are available for your brain to do whatever it needs to when you actually decide to do a journey. And also movement. I find that patients who have experiences with movement before a big journey are often able to come back to ground, to integrate. They're less likely to dissociate or have a hard, intense body experience if they go into it having their body actually prepared with movement. For me, that can often look like yoga. I feel like the stretching and the strengthening practices in yoga have helped me so much with any other work that I'm doing in the emotional, the psychic, and spiritual realms as well. And so I often will talk to patients about what that looks like in the week or two before leading up to a journey. But please do incorporate movement in whatever way feels good and nourishing to your body. That can be walking out in nature, forest bathing. That can be swimming. I feel like water is so cleansing and clearing for the soul and the spirit before a journey. There's so many ways to do this. Ecstatic dance is one of my favorites as well, just moving your body with rhythms and music. Yeah, and I think that the next preparation technique, which most patients are doing to some degree, is really setting a foundation and intention for the journey work. And so sometimes that just looks like, taking out your journal a week or two beforehand and spending 5 minutes going over what is coming up for you in your life, as right now in your experience, but also as your evolution as a person, as a being. What are you looking for? Are you looking to heal a past trauma or work on a difficult relationship? Are you looking for meaning and connection with yourself or a sense of purpose or direction that's been missing? Are you feeling a deep level of depression, loneliness, sadness, a difficult emotion that you're hoping to release and process more fully? Having a clear written or cognitive understanding of what that intention is really sets up the foundation for success in a journey space. And so it doesn't have to take a lot of time. It doesn't have to be very detailed. You don't have to spend a lot of time writing or going over it, but having a clarity. So what I often will advise patients to do is do a 5 minute kind of brainstorming session, just whatever's coming up in that moment, and then refine it in the week or two before the journey. So starting to move it from a large intention to a slowly clarifying, bringing it down to a pinpoint, really clear intention, so that going into it, it's very easy to ask and open to that. And then of course, there's still just a simple process of surrender in the moment, because we never really know where medicines are going to lead us or take us, but it's helpful to have a grounding and an intention beforehand. Tip number 4 is to prepare yourself for a journey by descheduling. So I find this is really helpful right before a journey, but especially in the space afterward, is give yourself a little bit of time, at least the first 2 weeks, to really have an openness, a spaciousness in your schedule. Don't rush right back into doing all the things all the time, because it's very easy for those deeply opening and vulnerable experiences to close right back up if we don't make enough space in our schedule to really embody the changes, the insights, the intuitions, the messages that come through in the journey space. And so I find that purposely descheduling yourself and saying no to some of the things that maybe you typically would in terms of social engagements or obligations is really helpful for that initial integration phase, and making sure that you're really taking care of your body during that time as well. But I like to deschedule myself beforehand so that I feel prepared. I don't have to scramble and do it in the last minute. And finally, I like to talk about what happens in the immediate space of time before a journey. So that also I consider as the preparation space. And if you know going into this kind of experience that you tend to be anxious, that you feel depleted after a journey, or worry about sleep or other body discomforts or concerns that can come up, I really like to have a few tools on board to help in that immediate time right before you go on a journey. The naturopathic toolbox is really wide, so I'll often use either physiologic dosage of herbs, which is like a tincture, so a capsule or a tincture of an herb as an ally to help support you on your journey, or something like a flower essence, which is very gentle. It's more energetic. I use both gem essences and flower essences in my practice. So gems tend to be more structuring, grounding in the structure for people who maybe struggle a little bit with boundaries or with feeling grounded in the psychedelic space, or maybe who are doing group work and are concerned about taking on other people's energies. I really like to have those available to use right before a journey, during a journey. They're very gentle and are almost like sister plants or allies that I use to help people in those spaces. Or on a more physical level, some patients feel really depleted after a big journey, and something like 5-HTP, certain B vitamins, are really helpful for boosting and allowing your body to have all of the nutrients available to integrate those psychedelic medicines. For example, we know that antidepressants will deplete B vitamins over time. Vitamin B6 is an important cofactor for some of the antidepressants. And so augmenting, supplementing before a journey, immediately before in the day or two, really can help the experience be even better, and especially coming out of it, reducing a likelihood of feeling really off, really tired, really fatigued, or kind of hungover after a journey experience. I also really like to emphasize the importance of certain nutrients if patients are microdosing. either with or without their medications. Because if you're using a medication like an antidepressant, you might be depleting certain vitamins and minerals in that space, and then adding on a microdosing schedule could do that a little bit more. So it's nice to have some preparation before a big journey that includes some of those essential nutrients, cofactors, and vitamins. So again, really thank you so much. This has been about a 10-minute video. Thank you so much for watching. And just remember, when you're in the psychedelic space, trying to make sure that you're using that triangle: prepare, journey, integrate, kind of going all the way around the triangle if you have time and space to do that. So again, those tips, just as a summary, were to get yourself checked out in the month or 2 months before a big journey. Make sure that your body is healthy and vital and available for a good healing experience if you're going into that space. Optimize in the week or two before you do a journey, and that includes really good hydration, gentle movement, whatever you can incorporate, and lots of available nutrients if you can. The third tip is to make sure that you're setting an intention and starting with whatever comes up for you, spending a little time in that broad space, and then narrowing it down and clarifying an intention so that it becomes really crystal clear before you do any kind of journey work. The fourth tip is to try and deschedule yourself, and do this in the preparation phase. Do this before the journey so that you don't find yourself after a big journey having to scramble to cancel plans or this and that. Just give yourself lots of time, at least in the first 2 weeks after a big experience, to be slow, to have less things to do, less obligations and others that you need to necessarily engage with. And finally, just think about some of the ways that you might need to be supported immediately before the journey or even during the journey. I love using plant medicines and plant spirits as allies on certain journeys that make me feel really held, grounded, and safe. So if you can incorporate some of those allies with you, then I think your journey will be even better. Please feel free to reach out to me via my email, which is lindsay.wilkinson@hushmail, hushmail.com. You can also find me on both of my websites, which is www.drlindsaywilkinson.com. No dots or anything there, just drlindsaywilkinson.com. And my clinic space, which is at the base of Mount Tabor in Portland, and that's called Aureo, www.aureo.com, Aureo. I hope to see you all again, and thanks so much for watching.